Everywhere we look, inequalities that are deeper than ever are constraining people's ability to meet their essential needs, one of the most essential being food. Designed and implemented effectively, robust social protection systems can reduce inequalities, support individuals, and address food insecurity. But how do we get there? Renowned social economist Professor Naila Kabeer and Nobel Laureate in economics Professor Abhijit Banerjee are here to talk about just that. And to guide the conversation, we're honored to have the Assistant Executive Director of the World Food Program, Valerie Guarnieri. Over to you.
The conversations at today's Action Zone all focus on actions to address poverty and inequality. One really important instrument that governments have at their disposal to address these challenges is social protection. These are the policies and programs that aim to prevent and respond to poverty, vulnerability, and social exclusion by giving people access to support, often cash or in-kind transfers, but also other types of services. Today, we are delighted to host a conversation with two of the world's leading thinkers on poverty and inequality, Professors Abhijit Banerjee and Naila Kabeer, to explore some of the biggest questions in social protection: how we can help people get substantially increased access to national social protection systems, leaving no one behind, and how social protection programs might be improved to provide more effective protection for those in need and those at risk. Welcome to you both. Professor Banerjee, Professor Kabeer, we're talking to you at a vital moment for social protection globally. Before the pandemic, over 700 million people were estimated to be in extreme poverty, and a similar number were estimated to be chronically hungry. Many people will have been suffering from both. Now, COVID-19 has plunged tens of millions more people worldwide into poverty and hunger. Poverty, hunger, inequality, they're so often interlinked. So programs that tackle one of these challenges have the opportunity to simultaneously help reduce another, which is why they are of such importance to our work at the World Food Program and at the United Nations as a whole. Now, for many years, governments and their partners have been demonstrating an increased commitment to investing in social protection as part of the solution. Already, some 2 billion people globally were being supported by social protection before the pandemic. And with COVID, nearly every government in the world has been adjusting its programs or introducing new ones to respond to the global crisis. But there's still a long way to go to maximize coverage and make the quality of these programs as effective as possible. We know that we must really support these efforts that are such a vital pathway to impact at scale on ending poverty and reaching zero hunger. Professor Banerjee, you and Esther Duflo have been pushed for a COVID-19 Marshall Plan for poor countries. Just as American funding bolstered a post-war recovery in Europe, financial support from rich nations can help avert a longer-lasting crisis in middle and low-income countries by helping governments manage the socioeconomic implications of the pandemic. What would a modern-day Marshall Plan look like? Where would social protection systems fit in? And how might the plan address the rising rates of poverty and hunger?
Well, I think the first order constraint is money. I think if you look at the richest countries in the world, during the pandemic, they spent about 20% of GDP in some form of social protection. That number for the poorest countries in the world, that's a lot of countries, still is 2% of GDP. It wasn't that they weren't trying. A country like Togo, to take an example that was, sort of stands out a little bit, actually set up a whole infrastructure for redistributing money very quickly in the pandemic, but then ran out of money very quickly and could not use it. So I think the first order constraint is money in hands of governments. I think that's that sounds old-fashioned, but I think that's probably before we talk of innovation and I think there's lots of work to be done. But I think the first order business, and that's sort of what we were arguing for, is to put more money in the hands of the poorer governments in the world.
So, Professor Kabeer, not all vulnerability is the same. And in the humanitarian development space, we're called upon to focus our attention on those who are most in need of our assistance. Your work explores the ways in which compounding vulnerabilities leave certain individuals and communities exposed to higher risk and unable to meet their essential needs. What does an intersecting inequalities approach entail, and why is it so useful to guide social protection policy and programming?
We really got alerted to the problem of intersecting inequalities as a result of monitoring progress of the MDGs. And we found that focusing on average progress very often meant that we missed out on the hardcore excluded, the extreme poor, because the problems that they faced were not just material deficits, though material deficits are important, but the way in which material deficits intersected with devalued identities and discrimination, with the fact that these people often lived in the most challenging environments that were hardest to reach and had very little voice. And so what an intersecting inequalities approach reminds us is that the poor are not a homogeneous category, that we need to understand where they are located, what their identities mean in terms of barriers, and what their priorities and needs are. And we need to design our social protection programs so that we reach those who have been so far left behind. I think the one phrase that I take away from the SDGs and which shows the progress from the MDGs is leave no one behind. And I think an intersecting inequalities approach alerts us to the kinds of barriers and constraints we need to take account of in designing social protection.
Well, thank you so much, Professor Kabeer. And just to explore this a little bit further, so you talk about the what, the need to ensure that these social protection programs are designed and implemented in a way that doesn't leave anybody behind. But how can we go about doing this?
I think we can go about doing this by trying to identify first what are the needs, what are the priority needs? And for those at the bottom, it will be things like food and health and other essential services. And then we need to identify what are the barriers that are preventing them from getting access. It may be money, it may be language, it may be location, but we need a very nuanced scoping of why needs are not being met. And that means trying to understand the constraints that are in the way. So for instance, if the problem is geographical isolation, right, that you live in a very challenging environment, then somehow we have to find mobile ways of delivery. We have to find infrastructural ways of delivery. So it really is about matching needs, constraints, and access. Does that make sense?
Absolutely. And I think the need to adapt the approach to meet the need is absolutely clear. So, Professor Banerjee, strong and inclusive social protection systems are so important for stability and peace. Can you share any strong examples that you may have seen across the world, especially in fragile or low income settings?
Let me start by start off from where Naila ended. I think I think one of the ways in which social protection systems often fail is through the internal operation of accountability. In a sense, I think there's too much talk of accountability in the world. When we try to make sure, we've been actually fighting a mostly losing battle with some state government in India, I won't name the state, where we're trying to get them, they have pensioners who are very poor, but they have a whole verification system for whether these pensioners are poor enough to get the pension. And basically, when we provide them with a list of people who should be on that list, they say, no, she might have a son somewhere else who's sending her money. Do you know? I think we have created now a certain paranoia about wasting money, and I think that paranoia is at the heart of a lot of systems that are which fail to especially address the poorest of the poor. The poorest of the poor often are discouraged by the bureaucratic procedures that we set up to sort of exclude those who we think are not deserving. But I think in general, good systems don't focus on inclusion rather than exclusion. And sometimes that means including some people who may not be the poorest of the poor or whatever. But I think it's systems that are responsive, which have the feature that, if I need something, I can go to them. I think, for example, overall, despite much criticism, India's rural employment guarantee system has had a lot of those features. I know too much about it. I could spend a long time explaining what the defects are, but it does have the advantage that when there's need, you see, like in the pandemic years, the number of days of work just went up dramatically. And I think that's the kind of system which you want, which doesn't ask too many questions and is willing to be responsive to need quickly. I think that's one of the features of a good system. There are others, like, for example, having enough resources, but I think being not too obsessed by making any inclusion errors is I think a good characteristic for a system.
So, Professor Banerjee, so India is a clear example. Any other examples that you have seen in your work and in your research?
Well, I think that if you look at the impact of, for example, Mexico's what used to be called Progresa and then Oportunidades, and now has been suspended, and I think it's going to be replaced by some other program. I think overall these programs generated very large reductions in poverty, and as well as improvements in both schooling and health outcomes. I think actually the last 20 years are replete with good examples of programs. My point was only, so I don't think we are lacking examples. It's more we're lacking a bit the capacity sometimes to do what I think Naila said, which is to make sure that the inclusion is at all levels. It's often the case that the poorest are just discouraged by the processes we put in place to run these programs. And so I think it's more, I don't think it's, at this point, I would say we have many good examples from the poorest countries which have put cash transfers in the hands of the poorest in the pandemic to richer countries like Mexico. There's lots of models. We have often the infrastructure, almost the infrastructure, for example, the payments through the phone system works very well in many parts of Africa, strikingly well in a sense. The fact that those are often linked to bank accounts. So I think there's a lot of work that's been done in building the infrastructure. I think now it's a question of sort of connecting them up and pushing the go button. I think it's a little bit like, I think that's where we are stuck a bit. I think there is the infrastructure. I think there's the ability to do much better than we're doing. And it's not that hard.
So build on good examples and good practice, invest, push the go button. I'd like to hear from both of you on what would be your top piece of practical advice that you would like to offer to national policymakers and practitioners on how to go about building a robust and effective social protection system in current conditions. Professor Kabeer, can I hear from you first?
Sure. It's not very practical. It's about the philosophy of practice. And I think what I'm really struck by is the idea of the philosopher John Rawls about a veil of ignorance. And I would like policymakers to place themselves behind a veil of ignorance where they do not know, should the world be reconstructed, where they would be located in their society. And I would like them to design a social protection system of the kind that they would like, should they be so unfortunate as to find themselves at the bottom of the heap. And that means they would want a system where they are treated as citizens with rights rather than people who are supplicants and deserving only of charity. They would want predictability. And to go back to what Professor Banerjee said, he talked about people getting discouraged by bureaucratic procedures, but they also get stigmatized by bureaucratic procedures. So we would like a fairly simple, straightforward social protection system of the kind we would want for ourselves. And therefore, we would want to extend that to everybody in society. So it is about a universal social floor, predictable, from which we can build our own pathways out of poverty.
I really like this philosophy. Put yourself in the shoes of those who you are looking to lift up and protect. Professor Banerjee, what would be your piece of advice?
I would go very much along the same lines. I mean, in our recent book, we've been arguing that the main failure of a lot of social protection systems is the fact that they don't embrace the idea of dignity, that the people who are the supposed beneficiaries are actually, it's not because we're doing them a favor, but because they are, as citizens, this is something they're entitled to. And in a sense, and they're entitled to be respected while being benefited. And I think that's key, is that I think a lot of people actually get discouraged by the system, partly because it's just too complicated, but also partly because it's hostile. It doesn't respect their identity, their way of being in the world. And I think if we started thinking about the social protection systems from the point of view of the beneficiary, rather than from the point of view of the regulator, I think we would design better systems. We will start to understand why people, we have programs in Indonesia, which we've studied, where 60% of the poorest don't apply for something that would be free money for them. They just don't apply because they just don't feel this whole thing is for them. And I think that kind of failure is so glaring that I think we need to start to rethink what are we doing wrong. And I think what we're doing wrong is a lot of time not understanding where the beneficiaries are coming from.
Professor Abhijit Banerjee, Professor Naila Kabeer, thank you so much for participating in today's Action Zone.
Thank you for having us.
Thank you for having us. Thank you for those questions.